Hello, my name is Sherry. I'm one of the inpatient physical therapists here at Sturdy Memorial Hospital. I'm joined by Kathleen, who's an RN and one of our nurse educators. We're going to review with you today what you can expect after having your total hip or total knee replacement here at Sturdy. The information that you'll hear is based on our surgeon's general protocol for total joint replacements, and some things may need modification depending on the patient's individual needs. So after you have your total joint replacement here with us, you usually will stay in the hospital for about 2 days. Most of our patients are discharged on post-op day 2, usually to home with services from the visiting nurses, which includes both nursing and physical therapy. Some individuals do require or choose to have a short rehab stay at one of our local skilled nursing facilities, and that usually is within about 10 days or so. Once you do go home, the visiting nurse services will start within 24 hours of your discharge and continues for about 2 to 3 weeks. And then once you have completed your home services, they will recommend that you probably start with an outpatient PT program, which your doctor will set up for you. Some of the things that you can do to prepare your home before your surgery, mostly for home safety, we recommend that you pull up any scatter rugs or runners or anything like that, or clutter that may block or cause any problems with your mobility from point A to point B. You will require some sort of assistive device initially, so you want to make sure you do have room for that as well. You are allowed to do stairs, and we will go over those with you while you're here in the hospital, and we can provide you with any equipment that you might need when you're ready to go home from here. Case management will meet with you while you're here in the hospital to discuss your discharge plan, set up any of the services that you will need, and get you any equipment that you might still require when you're ready to go home.
So my name is Kathleen. As Sherry said, I'm one of the nurses here. I work on the 2 inpatient units where we recover our orthopedic patients, McCann, which is on the 2nd floor, and Mount Plaisir, which is on the 3rd floor. So preparing for surgery, it's very helpful if you think about eating foods that are high in protein. Protein helps with wound healing. Things like milk, cheese, yogurt, chicken, fish, ensure. Also, it's very important to get enough fiber. Fiber helps with constipation. It helps reduce inflammation. It helps with digestion. Staying hydrated is very important before, during, and after your surgery. That's something that we're going to monitor very closely during your stay here at Sturdy. You will be given a light meal when you come up after surgery. As long as you can tolerate that, we will allow you to have a regular meals after that. And you will notice that you'll get a fiber supplement on your trays during your stay. And this helps with keeping your bowels regular. You will notice during your time here at Sturdy that there'll be a lot of concentration on your bowels. The nurses are going to listen to bowel sounds. We are going to be asking you about any bowel movements. We'll be administering bowel meds to you, and we'll be educating you a lot on the things that you can do to help keep your bowels healthy, like hydrating and movement. Movement is really important to keep your bowels going during this recovery time. So day of surgery, we call that day 0 here. You will come in to the hospital, you will come to a pre-op area, then you will go in for your surgery. Anesthesia is dependent upon your doctor and your own health circumstances to see what type of anesthesia you're going to have. Pain control is something that we're going to talk a lot and do a lot about for you during your stay here. Pain control is done with pain medication and with other interventions too. So for pain medications, we use IV Tylenol, which we have found to be very effective with orthopedic patients. So you will have that scheduled for the first 24 hours every 8 hours. And then you'll move on to scheduled oral Tylenol. In addition to that, we will also be giving you opiates. So the scheduled opiate is a long-acting medicine. It is what we call controlled release, so it gives you a little bit of medicine in your system for 12 hours. So twice a day in the morning and at night, you'll be getting a long-acting pain medicine. We also have available for you short-acting pain medications. So if you work with Sherry and her team and you have a lot of pain after physical therapy, or you're feeling pain before you even start working with them, we can give you a short-acting, immediate release pain medication. But that's something that's not scheduled. That's something that you have to ask us for. Some people use it several times a day. Some people don't ever need it during this day. So it's a very individualized thing. But we do, as it says, it is better to stay ahead of your pain. So that pain medication is something we're going to be asking you a lot about. If you live in Rhode Island, when you're discharged, it is better to fill your any pain medication prescriptions that you may have in Massachusetts. There are more restrictions in Rhode Island, and you can only get a couple of days. So the doctors do ask us to remind you, if you live in Rhode Island, to get them filled. But the other things that we will be doing to help with your pain are things like putting ice on the joint, positioning you in the bed or in the chair, and moving. Moving's really a big part of this. And then, as I said before, your bowels are something that we pay a lot of attention to. So you will be ordered for a combination of stool softeners. They could be Colase, Center, milk of magnesia, a suppository, and at the very end, if you're having issues, we do usually have a fleet enema available for you too. So pain is something that we're going to be monitoring closely with you. These are 2 scales that can be used. You'll find that we usually use the one on top, where we ask you to rate your pain from 0 to 10, 0 being no pain and 10 being unbearable pain. We also ask you what for you is an acceptable level of pain, because pain is very individualized. So what's acceptable to me may not be acceptable for Sherry. So we'll ask you what is acceptable to you, and we'll try to keep you at that point. But as it says here, we'll be asking you about the intensity, the location, the onset, the duration, the quality of pain. And we will be taking your vital signs a lot around the time that we give you pain medication. So blood thinners. Orthopedic surgery increases your risk for developing a blood clot. So the doctors are aware of this, and so all orthopedic joint patients do have an order for a blood thinner. There are several different kinds, as it says here. There's Coumadin, there's Lovenox, there's Xarelto. There's several things they can give you. And again, that is determined by your doctor and by you and your other drugs you take and your health circumstances. But it's important to take your meds at the same time every day, and we'll be doing that during your stay here at the hospital. It's important to check with your doctor before you try any other things, even non-prescription medications. And it's important to tell your doctor while you're here and after you've left if you have blood in your urine, or you're spitting up blood, or you're bruising quite a bit. Those are all important findings to report. We do a lab. It's called PT-INR. while you're in the hospital. It's done every day, and it tells us how well the medication is working that we're giving you. So the blood tests here are done in the morning. Um, if you have Dr. Bowman, he's an early person, so the lab will probably be in early to take your blood. Um, but we will do that, and we determine the dose of your blood thinner according to that lab work. It's important after you leave here to avoid major diet changes because this can affect it. Dietary will come around to talk to all of you about if your particular blood thinner requires any dietary considerations. So, day of surgery. After your surgery, you will be brought into the recovery room. You're usually there for a couple hours and they monitor you very closely. When they feel that you are stable, they call us up onto the floor, and one of the nurses and transport will come down and pick you up and bring you back upstairs. When you come upstairs, the nurses have a lot of questions that we have to ask you. You probably will have been asked them earlier, but we have to ask them to you again. Sherry and all the other physical therapists are often waiting for us to be done with that because they want to get you moving on the day of surgery. But some of the equipment that you will come up with is possibly a Foley catheter. Um, that again is determined by your doctor and by your health circumstances. If you do come up with a Foley catheter, it's taken out first thing the next morning. It's taken out by the night nurse before she leaves, so it's usually out before 7 o'clock in the morning. We also do have everyone use the SCDs, the sequential compression devices. They are sort of a sleeve that we wrap around your legs. They inflate and they deflate. And I find that some people absolutely love the SCDs and are comfortable having them on anytime that they're in their bed. Some people do not like them as much, so we try to work with you. We do encourage you to use them, but if they're absolutely driving you crazy, let your nurse know and we can come up with a plan together. We also use TED stockings, and that's something that everyone will get. Usually, oftentimes they're put on in the OR. If they're not, we'll be putting them on when you arrive onto the floor. And they're very important. They promote increased blood flow back to your heart, and that can help prevent blood clots. So you will have your TEDs, and that's something that you will be wearing even after you leave the hospital. You'll all come up with an IV, which they'll insert in pre-op with IV fluids running. It's, like I said earlier, it's very important for you to stay hydrated. And because people are often sleepy that first day and they may not be drinking enough, we do leave the IV fluids running at least through that first night. And then the next day, if you are drinking and eating well, we can turn off those fluids. So it'll be one less thing that you will have attached to you. And then the electrocool or ice. So if you have a knee done, we have an electrocool, which is sort of like an ACE wrap that we wrap around your knee on top of your dressing. And it is attached to a machine that's plugged in, and so it can provide continual cold therapy to that joint. We take it on and off throughout the day. You can have it on when you're in bed. You can have it in when you're sitting in the chair. But ice is great. It can decrease the swelling and it can help with pain. If you have a hip, we usually will put ice up against that in an ice bag. And again, that's on and off throughout your therapy, but most people find it very comforting. And your dressing. So this is a picture of a honeycomb dressing, and that is what both of the doctors use now, or all of the doctors use. We've been using it for several years, and it really is a nice dressing. It can stay on for up to 7 days, which has a great benefit because it reduces the risk of infection with us taking it down and redressing your wound. As a nurse, we love them because we can see your incision through this honeycomb-looking dressing. And the white there wicks away any drainage, so it's safe and good for your skin as well. Usually, the doctors will tell us not to change it, that if you do have a lot of discharge, to reinforce it, but they like us to keep it on. You'll go home with it, it will stay on for 7 days, and then it can come off after that. But it's really a nice dressing that we've been using for several years now.
Okay, so this is Sherry again. I'm just going to go over what you can expect from a rehab standpoint while you're here in the hospital. Like Kathleen mentioned, we actually are going to be starting physical therapy the day or evening of your surgery, depending on what time you go in. What we do with you that day really is going to depend on you and how well you're doing, how well you're feeling. But the majority of people are able to do some sort of activity like sitting up on the edge of the bed for a little bit, standing up to the walker, or even walking in the room or out in the hallway. So it really depends on you what we will be doing with you on that day, but we will be checking in with you. Every day after that, you are going to be seeing physical therapy twice a day, once in the morning, once in the afternoon, to work on things like getting in and out of bed, sit to stand out of the chair, walking with a walker, crutches, stairs, range of motion strengthening, and things like that. You also will be coming into contact with our occupational therapists, and what they usually work on is things like bathing, dressing. They'll probably bring you into the bathroom, make sure you can get on and off the toilet, make sure you can stand at the sink to wash up, brush your teeth, things like that, to prepare you in order to go home and do these things as independently as possible. So when we first get you up to start walking, we usually will start you off with a rolling walker. That's the walker that's pictured in this picture with the two wheels on the front. It's a little bit more stable, so initially we want you to have that stability to be able to test out that surgical leg. You actually are allowed to put as much weight as you can tolerate on that new knee or hip that you have done. That joint will support you. And we will go over how to utilize the walker, and we can progress you off of the walker onto crutches, canes, things like that as you progress through your rehab, whether that be here in the hospital, home, or at a rehab facility. Like I said earlier, you are allowed to do stairs. Most of you are probably doing stairs currently, like it says here, up with the good, down with the bad. And we will go over how to do stairs while you're here in the hospital. We want to make sure that you're feeling comfortable doing them, but you're also safe doing them as well. Some people do choose to set up their home with a place to sleep on that main level so that they don't have to do as many stairs. But it is a possibility, and we will work with you while you're here to make sure we set up the best possible setup for you. So see, these are some of the early on exercises that we're going to be starting with you pretty much the night of your surgery. Ankle pumps, which is really just wiggling your feet up and down. Very, very important exercise to do. Helps maintain that blood flow and that muscle and range of motion going. Quadricep sets, which is the second picture down, which is basically just tightening up your thigh muscle and pushing that knee down into the bed. Glute sets, which is just squeezing your bum cheeks together because you need those bum muscles to help you walk. Heel slides, which is the bottom picture, that's just basically working on range of motion, bending that knee, bending that hip, and getting that to loosen up for you. And the straight leg raise, that is a big, big exercise for our total knee patients. So if you're having a total knee replacement, this exercise here we're going to try with you every single day. If you are able to do that exercise with good control on your own, we do not need to put any bracing on your knee when we get you up and walk. So that is a very important exercise, and we will definitely check on that every single day to make sure that you can do that. We also work on exercises in sitting as well as standing. Getting your hip and knee to work through that range of motion is ideal. The doctors do not like if you're putting any pillows or anything else like that underneath your knee to keep it in that slightly flexed position. It tends to get a little stiff in that position, and then it's harder to gain that full knee extension. They actually prefer that you have a roll of some sort underneath the ankle or heel to help encourage getting that knee completely straight. So if you're having a total hip replacement, there are a few positions and motions that you have to be careful with and be aware of. They typically will, your incision will typically be just behind your hip joint into your bum cheek there. And the reason why they have these precautions is the way they have to get in there to fix that hip and do the surgery. So while it's healing, the three things that you want to be careful with is one, you don't want to bend your hip past 90 degrees. So anytime you're sitting on a surface, you want to make sure that your knee is slightly lower than your hip. And that will make sure that you're not bending that hip past that 90-degree angle as long as you're staying up straight. That also includes things like getting dressed, bringing that knee up towards your chest. You want to keep that knee below that hip. The other one is no turning your leg in towards your other leg. So that's internal rotation. So not a lot of twisting motions. You want to make sure that your knee, your foot are pointed forward to make sure that you're not turning that leg in. And then the last one is no crossing your legs. And this is difficult for some people, especially when they're sitting. But one of the main things is you want to make sure that you don't cross your legs. The neomobilizer, believe it or not, you will all have a neomobilizer, whether you have a hip done or whether you have your knee done. If you're having your knee done, there's only two times where the neomobilizer has to be worn. One is at night while you're sleeping for about a week or two. The other is while you're up and walking, while you're weight bearing on that new knee. We'll put that knee immobilizer on if you cannot do that straight leg raise exercise that I spoke about earlier. If you're able to do that straight leg raise, we do not need to use that knee immobilizer while you're walking. But make sure you still bring it home with you because you will have to wear it for about a week or so at night while you're sleeping. For the hip replacement, you will have to only wear the knee immobilizer at night while you're sleeping. I do highly recommend that you still utilize a pillow between your knees, especially if you're going to roll or sleep on one side or the other, just to maintain that alignment of the hip joint and to minimize irritation from the knee immobilizer on your other leg. With the total hip replacement, those hip precautions are in place throughout that healing process time. How long your doctor recommends that you maintain those hip precautions is completely up to him, but your normal healing process time can range up to 12 weeks. So this neomobilizer will be your buddy at night for quite a while. So definitely you want to get used to wearing that at night and having that other pillow between your knees when you're rolling. And that is pretty much it. I want to thank you for your time. These are phone numbers that you can contact if you have any questions in the upcoming week or so prior to your surgery, or if you have any issues once you leave here, you can always give us a call. So I just want to thank you, and we will see you soon.
Thank you. See you all in a little bit.